Our topic focuses on something that's becoming a really serious issue in healthcare: nurse burnout and how it affects mental health. So, what exactly is nurse burnout? Basically, it's when nurses feel completely drained emotionally, physically, and mentally. It happened after working really long hours, handling heavy workloads, and being under constant pressure without enough time to recover. Over time, this exhaustion can lead to what's called depersonalization, when nurses start feeling disconnected from their patients and a lower sense of accomplishment in their work. In the last few years, especially after the COVID 19 pandemic, this issue has become a global concern. Nurses were under extreme pressure, caring for very sick patients while also facing staff shortages and not getting enough rest. Many of them were exhausted both physically and emotionally after seeing so much suffering every single day. According to Melnick and colleagues 2025, in their study published in Board Views on Evidence-Based Nursing, burnout and poor working conditions are some of the main factor linked to serious mental health problem in nurses. Things like anxiety, depression, and even suicidal thoughts, especially among those working in high risk settings. But the research also pointed out some positive things, like protective factors such as supportive leadership, healthy communication, and access to mental health resources. Those elements can really make a difference and help nurses feel safer and more supported in their workplaces. These findings remind us that nurse burnout isn't just a personal issue. It's actually a system wide problem that affects the whole healthcare environment. When nurses are burned out, the quality of patient care often drops. Safety can be compromised, and more nurses start leaving their jobs, which only makes the workload heavier for those who stay. It's like a cycle that keeps getting worse
In
on.
the peer reviewed article, Nurse Burnout and Patient Safety, Satisfaction, and Quality of Care, a systematic review and meta analysis, Lee et al. 2024, investigates how nurse burnout can have an overall effect on the quality and safety of a patient's care. The authors conducted 85 studies of 288,581 nurses across 32 different countries to examine the association between burnout, patient safety, satisfaction, quality of care, and the different kinds of strains it can cause. Through analyzing, it was revealed that higher levels of burnout were strongly linked to being rated lower in terms of patient safety. It increased the medical errors were seen, and it decreased patient satisfaction. This means that burnout not only causes harm for nurses and their patients, but also compromises the health system as a whole. As stated in the article, the emotional exhaustion and depersonalization dimensions of burnout, more so than personal accomplishments, were observed to be the most closely associated with patient safety. Lee et al. 2024. This study emphasizes that burnout, which equals emotional exhaustion and depersonalization, has more of a greater negative effect on patient safety than the nurse's personal accomplishments, or in other words, ability to perform care. Based on a peer reviewed article published in Human Resources for Health in 2020. The author defines burnout as a psychological syndrome that results from prolonged exposure to chronic stress at work. In nursing, this often shows up as an emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. It economically leads to more sick days, higher turnover, and lower job performances, which increases costs for hospitals. And politically, burnout highlights system issues like staffing policies and lack of mental health resources. Overall, this shows that burnout isn't about just being tired, it's a serious mental health concern that affects both nurses and the quality of patient care. Addressed workload, staffing, and support system is essential to protect nurses' well being. Now we'll talk about critical social theory in relation to this issue. This issue can mainly be examined using critical social theory, which focuses on understanding and addressing unequal social, economic, and power relationships within healthcare society. The CBC article, supported by evidence, emphasizes that burnout is not caused by the person working as nurses, but rather a problem caused by power imbalances between government and nurses. Viewing this issue through critical social theory helps to promote awareness of inequalities within the health system, highlights restraints set on the autonomy of nurses, and questions assumptions of the normalization of overwork and burnout being full nurses. In addition, critical social theory allows for the root causes of burnout to be addressed, such as the lack of government assistance and staff shortages, and shifts accountability from just nurses to policymakers and governments, allowing for more effective and lasting solutions. Addressing burnout through this lens helps to benefit the marginalized group, which in this case the nurses, by highlighting the importance of hearing the voices, giving them more power in decisions, and creating safer, more inclusive work environments, which ultimately allows for better well-being of nurses and patients. Social theory approach enhances the discussion of nurse burnout. It shifts the focus from individual resilience to systematic issue and power structure that contribute to the problem. The article does more than just state that nurses are tired. It quotes one nurse: "We're not able to provide the care that we want to provide." The powerful endorsement shows burnout is not just an individual challenge; it's a moral and emotional toll rooted in institutional failures. The article calls for accountability from healthcare leaders. It urges them to address systematic conditions instead of placing the burden of coping solely on nurses. However, the article does not address the human aspect of burnout. It misses the mental and physical strain nurses face daily as a part of a failed system. It misses an opportunity to explore the profound grief, shame, and erosion of professional identity that nurses experience. The article also fails to include key voices. We hear from nurses about the system's flaws. We do not hear from patients and families who directly experience the consequences of a compressed care. Where's the family member who had to change a dressing because no nurse was available? Where's the patient who fell while waiting for assistance? Burnout erodes trust, delays care, and compresses patient safety. Without these voices, we miss the full scope of the issue. This limits our ability to address not the just nurse burnout, but the broader impact of the healthcare system. Cultural considerations. Burnout. It is used to describe the emotional response to workload and stress. However, research on culture has shown that burnout does not affect all nurses equally across the field. The cultural identity and social location of nurses shape their experiences in workplace environments, the support they receive, the discrimination they may face, and the emotional strain they may deal with. Thus, cultural considerations are essential for understanding the causes of nurse burnout and the consequences that can accompany it. In Canada, one of the most affected yet rarely discussed groups of nurses in burnout research are Indigenous nurses. Unfortunately, they go through cultural exclusion, emotional harm, and on top of it all, Indigenous specific racism within both the healthcare and nursing education systems. These negative experiences lead to psychological distress, emotional exhaustion, and moral conflict, all three being significant parts of burnout. Bearskin highlight that Indigenous nurses are expected to assume additional cultural responsibilities, including advocating for culturally safe care and supporting Indigenous patients. This extra workload, also known as cultural burden, leads to increased fatigue and an increased risk of burnout. Internationally educated nurses also go through cultural and professional stressors. Several internationally educated nurses have reported unfair treatment, discrimination, and the overall challenges of communication and the language as immigrants in the Canadian healthcare facilities, according to the full support they need during their transition into practice. Despite the strong clinical skills they have, internationally educated nurses often feel undervalued, which can significantly impact their mental health and increase the likelihood that nurses will leave the practice overall. From these findings, it is clear that burnout is not just associated with long shifts or staff shortage. Still, the impacts of racism, discrimination, inequality, and lack of cultural safety affect the burnout of Indigenous and immigrant nurses. This means that both workload and structural inequalities shape nurses' mental well being. When it comes to these discussions regarding burnout and solutions to it, Indigenous and immigrant nurses' voices tend to be missing in them. Thus, without including these perspectives, the nursing community continues to ignore the inequalities that affect professional well being.
Nursing implications. To address the severity of this issue would begin by recognizing early signs of symptoms progressing into long term burnout. This may include noticing frequent fatigue or irritability in healthcare workers and in response observing their declining work performance, along with patterns of absence and withdrawal during social interactions, all highlighting the unwillingness to perform due to constant pressure. The next step would be to combat the issue of burnout by encouraging techniques to relieve stress and promote self care, whether it be by performing meditation, journaling, or talking about their stress rather than concealing it. It would also be beneficial to remind colleagues to take care of their physical health, as it is closely tied to emotional well being of a worker. Then, to get at the root cause of the issue and combat the issue in the long term, advocacy would be necessary. A primary reason for the burnout is often reported to be the inadequate staffing, which creates high stress situations in which nurses have to work long hours continuously with minimal rest and the emotional exhaustion that occurs from the constant distressing situations. Therefore, change is needed through participation of nurses in staff meetings or committees to voice the issues and supporting policies that resolve or limit excessive overtime or mandatory additional shifts. Lastly, to ensure that the change remains implemented, nurses should be provided lines of open communication that are easily accessible and anonymous as a means to continue voicing their concerns. Additionally, healthcare workers should be provided access to mental health support. The organization should have support contacts that they have present on site for immediate support and prioritize posting helpline numbers to deal with the effects of such intense situations that millions of nurses and other healthcare workers experience across the board.